also diarrhea and constipation are two of the most common side effects also from chemotherapy specifically. Any recommendations you have?
Yeah. So for both diarrhea and constipation, one of the most important things to remember, too much food is going to worsen the symptom. So again, we want to shift to smaller, more frequent meals. If you're having diarrhea, you do not want to eat a big meal. Your body's not going to know how to digest and tolerate it. If you're constipated and you eat a big meal, it's just going to build up and you're just not going to feel very good. It might make you more nauseous at that point. So smaller, more frequent meals for both. We do want to encourage hydration for both as well too. In diarrhea, you lose a lot of fluid, right? And if you're constipated, you might be dehydrated. Your stool might be dehydrated. So you need more fluid to soften the stool as well too. But one thing that specifically is a little different with diarrhea and constipation is the types of fiber foods that you want to choose. So fiber is found in plants, right? So whether it's fruit or vegetable or nuts or seeds or beans or grains, those are fiber foods. But one thing I want to encourage is if someone's having diarrhea, you want to avoid any scratchy fibers. So ideally, you want to try to choose gentler fibers if you're having diarrhea because the fibers go through the GI tract untouched. So as they digest, they kind of scratch as they go through. And this slide kind of breaks it down a little bit more. So scratchy fiber is insoluble fiber. It's the column or the section on the left-hand side of the screen. So these ones, they kind of irritate as they go through, which is natural and is good. But if you're having diarrhea, you don't want that. So these are the kind of foods to try to limit if you're having diarrhea. If you're having constipation, you can have any kind of fiber, right? We want a little bit of irritation to help promote a bowel movement. But if you are having diarrhea, we want more of those gentle fibers, things like bananas, oatmeal, mashed potatoes. Instead of peanuts, I would rather you do peanut butter, or instead of fruits with tough skins on it, take the skin off, avoid the little seeds. You know, it's going to be better to do like melons, mangoes, bananas versus like a strawberry or an apple with the skin on it. You always can take a fiber supplement as well too, if it's approved by your team. So again, there's some conditions that you would have to definitely make sure it's okay if you're at obstruction risk or if you're post-surgery. But there are certain supplements that can promote bowel movement. So wheat bran is really good at stimulating the GI tract. Versus if you're having diarrhea, something that soaks up water a little bit more, like Metamucil. Or like there's some other specific little products like Bellway, Banatrol, Nanoflakes. Those are really good at soaking up water and helping form stool for diarrhea.
That's so helpful. Thank you. Thanks for all those tips. And the other two that I know patients with GI cancers, they deal with a lot is the obstruction risk, either because of the cancer or because they had a surgery, and then also stents. Any recommendations for these patients?
Yeah, so I think the first thing is make sure you're established with a dietitian to help you to really tailor your diet if you're at risk of obstruction or if you have a stent. If you are at risk of obstruction, you are going to want to avoid that scratchy soluble fiber. So that fiber that really maintains its structure throughout digestion, you want to be really cautious because it can build up at the area of the obstruction. It also can build up at the area of the stent as well too. So these diets really overlap. You want to just make sure all your veggies are cooked. You want to make sure you take the skins off any fruits or avoid any little seeds. And then also with like your nuts and your seeds and your beans, you want them pulverized. So you want them blended. So peanut butter or hummus or something that doesn't maintain that skin structure and that rigid structure, you are going to want to avoid. So kind of the way I view obstruction with skin stents is I call it the 3 S's. So no skins, no seeds, no stem. So when you're looking at your plant foods, you want to avoid any of those little seeds or skins that can get caught either at the level of the obstruction or at the stent.
Oh, that's such a great way to remember it, the 3 S's.
3 S's.
I'll start using that in my clinic too. Anything else? Any other concern that you hear from patients?
I would just say the biggest thing is just make sure you keep up with your hydration and your fluids during treatment. So typically we encourage at least 2 liters. Most people actually benefit a little closer to 3 liters of fluid a day. But what I would say is it's fluid, it's not water. Okay. So popsicles add up, broths add up, a protein shake or a smoothie, those all count towards your fluid needs as well too. So don't get stuck on the fact that you have to drink water strictly to meet your fluid needs. You might actually benefit from some beverages that have more electrolytes in them because people have high electrolyte needs. So I would say aim for 2. If you can do 3 liters, it's even better. and then don't feel as though it all has to be water.
And a lot of patients come in with their family members or caregivers, and the caregivers ask us, what can we do to help our loved one meet these nutritional goals? What can they do? What do you usually recommend to caregivers?
So one, I say don't take it personally. So if you are offering food and a loved one is declining it because it doesn't sound good at the time, do not take it personally. It takes a long time to really figure out what foods taste good. And sometimes, it's really hard to feel inspired with eating. So from a caretaker perspective, I would recommend always keeping a food list. If something went well, say a tomato basil bisque went really, really well yesterday, please write it down because it's going to be easier to reference a list of foods that have been going well versus trying to think of something on the spot when you're not motivated to eat. Also, just having food available, a small little bowl of Chex Mix or something like that next to someone while they're watching TV. It might inspire them just to kind of unintentionally graze a little bit. So just kind of have things available, just sitting there, or maybe like a protein shake, just sitting there. You don't necessarily have to encourage it, just have it there. So just stay consistent. Don't take it personally. And then just really try to have a lot of options available, because if the appetite is low, you need to offer a lot of small meals throughout the day. And the odds are if they eat it once, they're not going to want it again for 2 weeks. So you have to have a lot of options available and just think outside the box.
This is so helpful, Hannah. Thank you so much for joining us and for giving us all your knowledge so that patients can benefit from this. Thank you again.
Of course, I'm more than happy to be here, and thank you so much for including me.
Thanks.